Hi, everyone. Today I'm going to speak about emergency drugs in dental practice. Dental practitioners have a duty of care to ensure that an effective and safe service is provided for their patients. Survival from cardiac arrest relies on a sequence of time-sensitive interventions. First thing to do is recognize patient's illness and immediately call 999. At the same time, start CPR to buy time, and early CPR saves so many lives. Ask for help to bring defibrillation to restart the heart. Post-resuscitation care will restore quality of life and preserve cerebral and myocardial function. Many people who suffer an out-of-hospital cardiac arrest display warning symptoms for a significant duration before collapse. These symptoms could include chest pain, dyspnoea, breathlessness, nausea, vomiting, dizziness, syncope. Look inside the mouth and remove obvious objects, for example, dentures. Listen to stridor, snoring, and gurgling noises, then use suction to remove blood or vomit. Do jaw thrust, head tilt, and chin lift. Insert oropharyngeal or nasopharyngeal airway if the patient has no gag reflex. Maintain an oxygen saturation of 94–98%. Always give oxygen initially in the acutely unwell patient. Look for chest expansion. Use a non-rebreather mask and give oxygen initially to all patients. Use bag valve mask if poor or absent breathing effort. Feel for a central pulse, carotid femoral rate and rhythm. Check for capillary refill time. Check finger prick glucose. Look all over the body for rash or injuries. Asthma is characterized by episodes of reversible airway obstruction, where hypersensitivity to certain triggers sets off an inflammatory response during which mucus is released and the muscles of the bronchi constrict. Causes of an asthma attack include smoking, dust, animals, stress, chest infection. In the dental practice, stress can trigger an acute asthma attack. Signs and symptoms of asthma include wheeze, shortness of breath, chest tightness, cough. Now assess the patient following the ABCDE approach. Sit the patient up. Encourage the patient to take 2 puffs of a short-acting beta-2 adrenoceptor stimulant inhaler, for example, salbutamol. If the patient doesn't rapidly respond, administer further puffs. Angina pectoris is a condition marked by severe chest pain, often also spreading to the shoulders, arms, and neck, owing to an inadequate blood supply to the heart. Angina occurs when an increased myocardial oxygen demand cannot be met by the coronary blood supply. If an angina attack occurs and not a myocardial infraction or heart attack, the pain should ease with rest, though the administration of glycerol trinitrate spray or tablets may be needed. Hospital admission is not necessary if the symptoms are mild and resolve with the patient's own medication. Angina causes can be exercise, climbing stairs or incline, emotion, anger or anxiety, large meal, increase cardiac output by 20%, cold, windy weather, exciting programs, lifelike frightening dreams, sexual intercourse. Signs and symptoms are crushing pain, heaviness or tightness in chest, pain in arm, throat, neck, jaw, back or stomach, pain associated with sweating, lightheadedness, sickness, or becoming short of breath. Treatment for angina. If patient diagnosed with coronary heart disease and has glycerol trinitrate, GTN spray or tablets, and experiences symptoms, it can be managed with rest and GTN. But it could be myocardial infraction, heart attack. Administer aspirin 300 mg, ask patient to chew it, which has antiplatelet effect, and call 999. Syncope can be defined as a brief loss of consciousness caused by a fall in blood pressure. The commonest cause of syncope is a vasovagal attack or simple faint. The term vasovagal denotes a temporary fall in blood pressure with pallor, fainting, sweating, and nausea caused by overactivity of the vagus nerve, particularly as a result of stress. In the dental practice, the most likely cause of a syncope episode is stress. Other possible causes include warm environment, prolonged standing, sudden fright, visual stimulus, for example, sight of blood, sight of a needle. Signs and symptoms that may be evident include sense of feeling unwell, lightheadedness or dizziness, nausea and vomiting, sudden tiredness, yawning, blurred or tunnel vision, pallor, sudden collapse. If the patient feels faint, advise him to lie down. Put the dental chair in a horizontal position. If the patient starts to collapse, if possible, support him to the floor, taking care not to sustain an injury while doing so. Call out for help. Assess ABC to rule out cardiopulmonary arrest. As soon as the patient is horizontal, he will usually start to regain consciousness. Ensure a supply of fresh air. For example, loosen any light clothing around the neck and chest, open a nearby window or door, and ask colleagues not to crowd around the patient. Reassure the patient. Once the patient regains consciousness, offer a drink, for example, sugar in water or a cup of sweet tea. Typical characteristics of a generalized tonic-clonic seizure include sudden loss of consciousness and collapse to the ground, rigidity tonic phase, lasting for approximately 10 seconds, breathing stops, central cyanosis, particularly noticeable around the mouth, clenching of the jaw, convulsive movements clonic phase, lasting for 1 to 2 minutes, incontinence, variable period of unconsciousness following the event. Causes of seizure include epilepsy, head injury, certain poisons, for example, alcohol, ecstasy, alcohol withdrawal, cerebral hypoxia, cerebral hypoglycemia. Treatment. If necessary, call 999. Ensure that it is safe to approach the patient. Protect the patient from injury. Loosen any clothing. Cushion the patient's head. Note the time in order to check how long the seizure lasts. Once the seizure has stopped, check airway, breathing, and circulation. If the patient is breathing, place him into the recovery position. If the patient is not breathing, start resuscitation. Stay with the patient until he has made a complete recovery. Administer oxygen salves. Consider medication if the convulsive movements are prolonged more than 5 minutes. Administer midazolam buccally. A stroke is caused by either cerebral infarction or cerebral hemorrhage. Cerebral infarction is due to thrombosis, cerebral embolism, or very occasionally an episode of hypoperfusion. Cerebral hemorrhage, 20%, associated with hypertension, subarachnoid hemorrhage, and bleeding disorders. Symptoms may include sudden weakness or numbness of the face, arm or leg on one side of the body, sudden severe unexplained headache, sudden loss or blurring of vision in one or both eyes, sudden difficulty in speaking or understanding spoken language, sudden confusion, loss of balance, dizziness, unsteadiness, or a sudden fall. The Stroke Association recommends following the FAST approach. Facial weakness. Can the patient smile? Has her mouth or an eye drooped? Arm weakness. Can the patient raise both arms? Speech problems. Can the patient speak clearly and understand what is being said to him? Test all three. Assess the patient following the ABCDE approach. Also assess the patient following the FAST approach. If a stroke is suspected, call 999. Ensure the patient has a clear airway. Following a stroke, the airway can become compromised by the tongue. Aspiration of gastric contents or secretions is a serious complication of a stroke, which is associated with considerable morbidity and mortality. If the patient is unconscious but breathing, place him in the recovery position. Inserting an oropharyngeal airway may be helpful. If the patient is conscious, ensure his head and shoulders are supported in a slightly raised position. Tilting the head towards the affected side allows secretions to drain out. Regularly monitor the patient's airway and do not give him anything to eat or drink. Administer high-flow oxygen using a non-rebreathe mask. Hypoglycemia is normally defined as a blood glucose level less than 3 and is usually associated with diabetes. When attending for dental treatment, diabetic patients should eat as normal and should take their medication, for example, insulin or oral hypoglycemic agent, as prescribed. Common causes of hypoglycemia include too much insulin, delayed or missed meal or snack, insufficient food, especially carbohydrate, unplanned or strenuous exercise, alcohol consumption without food, idiopathic. Medical causes of hypoglycemia include liver failure, Addison's disease, pituitary insufficiency. Assess using ABCDE. If patient conscious and allows to eat or drink, offer simplest and quickly absorbed food drink that contains carbs, glass of Lucozade or cola, glucogel, dextrose gel is absorbed via bucca mucosa, and if consciousness goes down, clear airways, put in lateral position, and if unconscious, use oropharyngeal airway device. Give high flow of oxygen using non-rebreathe mask and pulse oximetry to monitor. Administer glucagon. Anaphylaxis is an acute, severe hypersensitivity reaction that can lead to asphyxia, cardiovascular collapse, and cardiac arrest. Causes of anaphylaxis include drugs, for example penicillin, aspirin, local anesthetic, bee, wasp stings, foods, for example peanuts, tomatoes, fish, latex. The clinical presentation often includes urticaria, a rash of round red wheals on the skin which itch intensely, angioedema, facial swelling, respiratory distress, wheeze, stridor. Cardiovascular R, shock, tachycardia and hypotension, pallor. Assess the patient following the ABCDE approach. If able, stop or remove the probable cause of the anaphylaxis, for example, remove latex gloves. Recline the patient into a position of comfort, the supine position. If the patient is in shock, it will be helpful to raise his legs. Ensure the patient has a clear airway. Administer high-flow oxygen using a non-rebreathe mask. Use a pulse oximeter. Closely monitor the patient's vital signs. Give intramuscular adrenaline. Repeat after 5 minutes if no better. Thank you for watching.